Welcome to the Just Hard podcast, real nurses, real talk, real life, where we take the nursing textbook and drop it right into the hospital unit, where real nurses have real conversations about the tough stuff. Because in nursing, hard isn't the enemy, it's the making of you.
We're your hosts, Chelsea Justice
And Lisa Harding.
Two nurses who believe in teaching with honesty, heart, and a whole lot of practical wisdom. We know nursing school isn't just challenging, it's transformative, and we're here to help make that transformation clearer, more doable, and yes, even a little fun.
Every episode will break down the hardest concepts in nursing, show you how to actually show up in practice, and give you the tools to think like the nurse you're becoming. We share real-world stories, lessons we learned the hard way, and the moments that pushed us and our students to grow. Today, we have a special guest with us.
Hello, I'm Jesus Aguirre.
Jesus brings his experience working as an LVN and a whole lot of tech skills to help us navigate this podcast.
And today, Jesus has a very important job.
He'll be serving as our narrator.
And he'll also be voicing Bella, Edward, and Jacob.
Because today's podcast theme is Twilight.
And because we do not have any paid sponsors.
We make our guests work.
In Forks, Washington, the drama was vampires and werewolves. In real life, the drama is connective tissue. Tonight's case, systemic lupus erythematosus, a chronic autoimmune disease with flares, remissions, and an emotional regulation of a supernatural love triangle.
Today, we're talking about lupus, the disease that refuses to stay in one lane.
It's inflammatory, multi-system, unpredictable, and deeply committed to chaos.
Quick orientation.
For those of you who did not spend your high school years watching and fighting over who is Team Edward and Team Jacob, Edward.
I can go in the sun. I just choose not to.
Edward, you're the vampire, you're photosensitive, and you sparkle aggressively.
And Jacob.
I didn't ask to feel this way.
Jacob, the werewolf, reacts emotionally and immediately. And then, of course, there's Bella.
I can fix this.
You cannot, Bella.
So what is lupus? Lupus is a chronic inflammatory autoimmune disease characterized by flares and remissions.
It primarily affects connective tissue, which is why no system is off limits.
Skin, joints, kidneys, heart, lungs, brain, blood.
I'm involved in everything.
At its core, lupus is the immune system losing the ability to recognize self.
There's different types of lupus, discoid lupus or cutaneous, that affects the skin only.
Systemic lupus erythematosus, SLE, is multi-system involvement. That's the main one we talk about.
And then there's drug-induced lupus. That's caused by certain medications, hydralazine, procainamide, isoniazid. The good thing is that those symptoms stop when those drugs are discontinued.
Have you seen that a lot when you're working in the ICU, Chelsea? I haven't seen a lot of drug-induced.
I've never seen it.
Okay.
Yeah.
Cool.
But we give hydralazine all the time.
Yeah, we do.
Yeah.
Yeah, we do. Yeah.
So, lupus, chaos, lots of chaos for one immune system. I think it's time for a commercial break.
Yes. Hydroxychloroquine.
Reset the scene. This is not a flare med. This is not an emergency fix. This is maintenance therapy.
So, it's not dramatic?
Correct. Hydroxychloroquine is the foundation medication for lupus.
It modulates immune activity. It calms the immune system without shutting it down.
When taken consistently, it reduces disease activity, decreases flares, helps fatigue, joint pain, and skin symptoms, and protects against lupus nephritis.
Consistency matters.
This medication takes weeks to months to work.
Stopping it suddenly is a bad idea.
Nursing Pearl.
Baseline and annual eye exams due to rare but serious retinal toxicity.
Long-term vision matters.
Hydroxychloroquine. So who gets lupus? The exact cause is actually unknown.
But lupus develops from a combination of genetics, hormones, and environmental triggers.
Sunlight, stress, infection, surgery, and pregnancy. Those are the big ones.
So, existing?
Yes. Basically, it primarily affects women, especially during childbearing years.
And there's also a higher prevalence in African American, Hispanic, Asian populations, and even some geographical locations.
Yes. So what's the patho behind lupus?
This is where lupus becomes a full villain.
The immune system produces autoantibodies, especially ANA, anti-nuclear antibodies.
Yes, these antibodies bind to the body's own cells.
They form immune complexes.
I attack what I love.
Those immune complexes circulate.
And deposit in tissues, kidneys, skin, joints, vessels, brain.
And then they activate the complement.
So complement activation causes inflammation, edema, and tissue damage.
And then repeated inflammation leads to scarring and permanent organ damage. Scar tissue is non-functional.
That's why complement levels, C3, C4, drop during flares. They're being used up.
This is excessive.
In lupus nephritis, immune complexes damage the glomeruli,
leading to protein in your urine, blood in your urine, edema, and renal failure.
My kidneys.
Yep, the kidneys are the big one that we're always looking out for as we're watching for that lupus nephritis.
Yeah, you think lupus, you should think kidneys.
Mm-hmm. So what are some cues? Renal involvement, most serious complication.
Hematologic involvement involves anemia, leukopenia, and thrombocytopenia.
And then there's something called antiphospholipid syndrome.
An autoimmune hypercoagulable state that's caused by antibodies against phospholipids.
Leading to DVT, strokes, recurrent pregnancy loss.
Why?
I think it's time for a commercial break.
Before labs, we need to talk prevention.
2 things.
A hat.
And sunscreen.
I do not go outside.
Correct, but when you do.
Photosensitivity is systemic, not cosmetic.
I like the sparkles.
Bella, those are immune complexes.
High SPF, broad spectrum.
Reapply it like it's a medication.
I live indoors now.
SPF and a hat, wide-brimmed.
Non-sponsored.
All right, welcome back to the Just Hard podcast. Let's pick up on diagnostics and labs for lupus. There is no single diagnostic test.
Diagnosis is based on clinical features plus labs.
ANA, those anti-nuclear antibodies. Anti or auto? Auto.
Antibodies. Anti-nuclear antibodies.
Thank you.
Yep.
ANA. ANA is positive in 95 to 98% of patients. So in the majority of patients, but not 100%. So that means that it's not specific.
Yeah. Anti-dsDNA and anti-Smith are more specific.
And you might see low complement levels during flares.
A CBC will show cytopenias.
UA could show proteinuria if nephritis is occurring.
And then there's always a false positive RPR that can occur, a reactive protein.
Yeah, I remember I had a lady that was like 80-something years old, and she was on CRT, and we were trying to figure out what was going on for her, and we were working her up for lupus, and I remember that her syphilis test was positive, and I was like, oh, Grandma's been having a good time.
Yeah, go Grandma.
Yeah, but then it wasn't actually until I started teaching that I knew that the lupus causes a false positive.
Yeah. So the RPR is basically a syphilis test.
Mm-hmm.
Yeah.
Yep. All right. Nursing management, medication adherence.
Yeah. Avoid the sun, infection prevention, basically anything that's going to cause an overwhelming stressor could be a trigger.
Yep. And then monitor the kidneys in the labs.
Support mental health and quality of life. This one's tough because with lupus, there's so many different symptoms and they're vague that it can be difficult to treat. And I think, me being that old seasoned, nasty, crotchety ER nurse, lupus seemed to be the catchword. And so everybody would come in with lupus and it's like, yeah, right.
Yeah.
But really, it's devastating. It affects connective tissue. We have connective tissue all over our body. So.
And then a lot of women find out that they have it when they're pregnant.
Yes.
So that's the other big flare-up. So sun, pregnancy, but that doesn't mean that you can't have children, right?
Exactly.
You just have to wait, ideally 6 months without having
and you may
remission.
Miscarry, unfortunately, yeah, because it does affect connective tissue. Yeah.
Yep.
When I was younger, I thought love was the most dangerous thing in my life. I thought I was choosing between them, but lupus didn't ask me to choose. I showed up quietly, then loudly, then everywhere. Some days I feel normal. Some days my immune system wakes up and chooses violence. But I learned this. I am not dramatic. My disease is. I am not weak. I am inflamed. And taking care of myself is not giving up. It's surviving. Lupus is unpredictable.
Half vampire.
Half werewolf.
It's just hard, and you can do hard things.